8-year-old John Matthew Davis knows his way around the Children's Cancer Center at Batson Children's Hospital in Jackson. And his mom, Mandy, could be a tour guide at Boston Children's Hospital. His doctor, Betsy Harrington, is the link that joins these two Children's Miracle Network hospitals together in a collaborative effort to treat a disorder so rare that it affects only 50 people in the world.
It's more than a 1 in a million chance. I mean, it's ridiculously rare. It's blue rubber bleb nevus syndrome. Long name, actually fairly complicated illness as well. Just a handful of kids in the whole United States are diagnosed with this each year.
He had problems from the day he was born, but from about 8 months old, we really knew he had a serious problem. And then he was diagnosed completely with the blue rubber when he was 2.
It is an abnormality or a malformation of the veins that carry blood back toward the heart. So we have veins in all of our tissues. The most troubling part of this disease is the abnormal veins that become dilated or distended in the gastrointestinal tract. So the reason I see John Matthew is because he has ongoing, frequent blood loss from his GI tract. And that causes him to be iron deficient and severely anemic. So he doesn't feel well, he looks pale, and he requires lifelong transfusion therapy.
It's typical of this disease to have blue spots on the skin, much like a freckle, or I guess a mole is more like a mole because they can be raised, and they do have a bluish tinge to them. So, and that's usually the first giveaway that the child has this disease. He's got some right here. That's one right there. That's one right there. And they will grow. This one especially, it will grow bigger, and you'll start seeing it poke through the skin, and then it will fall off, and another one will come back in the exact same spot. When they get bigger, they feel kind of like rubber that is blue.
Fortunately, I did some of my training in Boston and worked with the vascular anomalies team there. It's a specialized team that treats children who have problems with their blood vessels. Because there are blood vessels in all of our tissues, he gets swelling in other parts of his body, and that can cause pain and limit the range of motion because it's causing pressure. They inject chemotherapy agents and other agents that actually cause scarring of the blood vessels, and that helps to reduce the swelling. There's also a surgeon there who specializes in removing the blue rubber blebs from the intestinal tract.
We've been up there numerous times. He's had 20 surgeries. He's had a few here, some there, and the doctors work collectively together to try to figure out the best plan, and they send the records back and forth.
Because of the frequent surgeries on his bowel, the specialist there does the removal of the blebs, but then he developed a complication, post-operative complication of adhesions, and our pediatric surgeons here take care of that. So he's taking care of both places.
Truly is a joint effort.
It is a joint effort.
So you can give tours of the city now?
Oh, yes. We call Boston our second home. We know the city just as well as we know pretty much here now. And
you never thought that would happen, did you?
I honestly never thought. This is kind of an ongoing thing until they either find a new cure, or we're positive that one day they will.
There's always hope and ongoing research, but at this point, it's a lifelong chronic illness. Because of the supportive care, transfusions, and the therapy that we do here at Batson, we help to keep him feeling better. It just takes frequent visits to the doctor.
It's hard. It's very hard seeing your child suffer every single day in some way or another, but I wouldn't change it because I have met so many wonderful people and experienced so many wonderful things and witnessed so many life-changing things while going through all this that I wouldn't change anything, because it's really opened my eyes and made me appreciate life and enjoy life and not worry about things that I can't change.
To learn more about Batson Children's Hospital, go to childrenshospital.umc.edu and like Batson Hospital on Facebook. I'm Jim Albritton reporting.